Hello, welcome to the new session of Virology. Today we will be discussing arboviruses. If we see first the objective of today's session, first we will discuss the general features of arboviruses, then its classification. It is a diverse heterogeneous group. Then we will see some common arboviral diseases which are common in India. So first, the most common is the dengue. Then we will discuss Japanese encephalitis, chikungunya, which is a re-emerging infection, and nowadays you will see many cases of this. Even it is common in Gujarat, and few other common viruses in India. So first we start with the arbovirus. So the name arbovirus, as it is explained here, it is derived from two things, that is arthropod and BORNE. Arthropod vectors are always associated with transmission of this infection. That's why this group is known as arbovirus. Basically, taxonomically, this group is a diverse. They are belonging to different family, but these all are viruses that can be transmitted by some arthropod, so they are known as arthropod-borne virus or the arboviruses. So the human are always there where the disease would occur. There must be some reservoir host in which this virus is maintained. Most of the time this reservoir host does not develop any infection, but they would maintain the virus. And essentially, there must be some insect vectors. It may be mosquito which sucks the blood, and from one human to other human. So human to human cycle may be there, or from reservoir host it would suck the blood and then it would transmit it to human. So both the cycle is possible, but this vector must be biological vector. It is not mere simple mechanical vector which would transmit virus from one place to another. The virus must grow in that vector. So basically mosquitoes are there, and some blood sucking flies are the vectors of this. So if you want to define it, it is a viruses maintained in nature by biological transfer between susceptible vertebrate host and by hematophagous arthropods. So such insects would be transmitting it. They multiply and produce viremia in vertebrates, multiply in tissues of arthropods, and passed on to new host. So these are the example of some arthropod vectors. Sorry. So the mosquito, the most common is the Aedes mosquito. Like in dengue and all that, it is also known as tiger mosquito because you will see that black and white lining, Aedes aegypti. Then Culex mosquito can transmit. The ticks, which are commonly ectoparasite of many cattle and the animals, which would suck the blood of that animal, which is a reservoir host, and when accidentally it bites human being, it would transmit the infection. And some flies like sandfly. These all are the common vectors which would transmit the infection of this. If you see, this is the classification. Here you can see that these viruses are, it is not a scientific classification because these are taxonomically different families of viruses, but as all are transmitted by arthropod vectors, they are grouped together as arbovirus. So these are the common diseases like SINBs and Venezuelan equine encephalitis, eastern equine encephalitis, like that. Chikungunya, which is common in India, transmitted by the mosquito Aedes. The host is human being. Even in Africa, it is seen in the monkeys also. And the disease it produces is the fever, arthalgia and the arthritis. If we see other group, so this is the, if I take the previous slide, these all are alpha viruses. So that is taxonomically same group. Then Bunyaviridae, this is another family, but they are also kept here because these all viruses are also transmitted by some vector, arthropod vector. So in this there are again a list of which in India common is the Crimean Congo hemorrhagic virus. Though it is not originated in India, but recently we have seen many cases of this. It has started with the area near the Sanand taluka of the Ahmedabad district, and then it is found in many parts of Gujarat. CCHF, that is the disease, Crimean Congo hemorrhagic fever. Basically it is a zoonotic disease. From cattle it would transmit to human being, but this disease is very dangerous to healthcare worker because there is no treatment. If some patient, if it occurs in the healthcare worker, many times it may prove fatal and there is a death of the person. One of our very bright student, he was UG student of our college, U Shah Medical College, and was doing PG MD medicine in VS NHL Medical College, and he suffered from this infection and we have lost his life. So healthcare worker must be very careful while dealing with the patient of CCHF, Crimean Congo hemorrhagic fever. Then third is the flavivirus group, in which dengue is very common. Even in India and worldwide also it is one of the commonest arboviral infection transmitted by again mosquito Aedes. Yellow fever, though not common in India, but in Africa it is very common. Again that is transmitted by Aedes. Japanese encephalitis, so though it was first identified in Japan, so known as Japanese encephalitis, now not that much common in that area, but in India it is there, especially in the state like Uttar Pradesh, Assam. Many cases of Japanese encephalitis is seen in the children. So as I've said, dengue is common in India and Japanese encephalitis. And other families which may be involved are the Rheoviridae and Rhabdoviridae, of which the Chandipura virus is there in India, though the cases are less, but it is there even in Gujarat, few cases, and there is always sporadic incidences of this virus which also produces encephalitis. So these are the this is the classification of this virus. Basically, as I have said, it is a heterogeneous group comprising of different families, but these all viruses are having one thing common, and that is they all require some arthropod vector to transmit the infection from either reservoir host to human or from one human to other human. So that is classification. So these are this is how it would be there. So there is a list of reservoir host, there is a vector, and there is the host. So mostly its natural host are the host which does not develop very severe disease. So they are mere carry the virus, they are carrier, and then it serves as a reservoir and the disease occur in some other host whenever they get infected. The clinical disease which commonly occur with this maybe sometime asymptomatic or mild. There may be arthralgia or arthritis, very painful condition. There may be fever with or without rashes. Then in severe cases, there may be hemorrhagic fever. So there is a group of viruses which produces hemorrhagic fever. There is a group of viruses which produces encephalitis. Sometime there would be pulmonary syndrome or renal syndrome also. So basically 3 things is very common: fever and rash, which may develop in the hemorrhagic fever or encephalitis. So these is the common features of any arboviral infection. So now we start with dengue. Many people call it dengue also, but the correct pronunciation is dengue. It is basically African word derived from the word dinga. It is one of the most important arboviral diseases, which is transmitted by Aedes aegypti, that is the mosquito, and also Aedes albopictus, that is the other species of mosquito. But both are, the genus is Aedes. It has 4 serotypes, and recently 5th is also isolated, but not found in India till now. There is no cross immunity among different serotypes. But if, for example, one person is infected with type 1, he or she becomes immune to type 1 for rest of the life. But there is no cross immunity, means if person is infected with type 1, he would not become immune to type 2. So he may get infection with other serotype, and on the contrary, the first infection with some other serotype would make that infection more severe and difficult to manage. So if somebody is having dengue once, he has to be extra careful and cautious not getting dengue again with second serotype, otherwise he would develop severe infection. Worldwide it is common, and as usual all the developing countries are the area where this mosquito are there, because the temperature which favors the breeding of mosquito would allow this mosquito to develop, and most of the time this mosquito would be there in or your neighbor's home, because this mosquito could not fly more than 100 meters. So it bites in daytime, Aedes. So where this control of this vector is not proper, then these diseases are very common. And in India, dengue is very common. In Gujarat also, last winter we have seen many cases of dengue. The clinical, though will not discuss in detail, but there would be fever, headache, and it is also known as breakbone fever, and there is a sufficient pain in the bone. That's why it is known as breakbone fever, means the pain is such that the patient feels that their bones are breaking. So, and the other name is also known as saddleback fever. Saddle means the things we put on the horse back, and on which the people used to stay, because it is a biphasic fever, and that's why it is known as saddleback fever. The platelet count will drop. That is a very striking feature of the dengue, and that may lead to DHF, that is dengue hemorrhagic fever, and other is DSS, that is dengue shock syndrome. And DSS is having very high mortality. You have to manage patient really well, otherwise we may lose the patient. So these are the some pictures of multi-organ failure and the hemorrhagic fever. Many rashes are seen due to loss of platelet and internal bleeding. Now, very important thing, that is lab diagnosis of dengue. The detection of NS1 antigen, it is very nowadays very useful test in which we detect it by ELISA, or even rapid card tests are available, immunochromatographic test. Though as per Government of India, that is not a confirmed diagnosis. If you can detect by ELISA, then it is a confirm. Same way, antibody detection can be done, where both IgG and IgM is detected. IgG would tell about the recent infection. IgG may be positive even if a patient is previously infected with some of the serotypes of dengue. Make ELISA, that is IgM antibody capture ELISA, that is M antibody capture. So that is also a very useful tool to diagnose dengue. Molecular methods are very useful and sensitive and specific, in which we can do real-time PCR. Now we are coming to other. Just before 2 years, many children died in Gorakhpur in UP, and this repeats after several years, and that is due to one infection that is known as Japanese encephalitis virus, JEE. So these are the areas where you will see, but in India, the northern and eastern belt of states are having much of the infection with this. The infection is transmitted by Culex mosquito into children, and many animals are their reservoir, but of that the pig is the amplifier host, because in that, when it occurs to pig, its number would increase manifold. That's why they are known as amplifier host, and it would infect the children's. So that is Japanese encephalitis. May be asymptomatic in few, then there would be fever, encephalitis, and it is one of the most common cause of acute encephalitis syndrome in India. So very important virus, and very important to manage. The vaccine is also available against this, may be given in the area to all the children, especially the endemic. It is not common in Gujarat. In Gujarat you will not see these cases, but many times in Uttar Pradesh these are there, and Gorakhpur and that area are the epicenter of that thing. Now the other, chikungunya. Again, it is not chicken, so it has nothing to do with chicken or hen, but this is again the African word that means bends up. It is an insect-borne virus. Alpha virus transmission is by Aedes mosquito, both Aedes aegypti and in re-emerging, even Aedes albopictus can transmit this. There is an acute febrile illness, fever with rash for 2-5 days, and prolonged bone pain that affects the joints and the extremities. And joint pain would remain for weeks or months or even years. So it is एक सीजन में थयो होय चिकनगुनिया इन्फेक्शन, तो it would give remembrance every year in winter कि हाँ मने पेन थयो तो, especially the joints of the small joints of fingers and all that would be highly affected. So very painful condition, but the good thing about chikungunya is it is not fatal like dengue. In dengue, if it is not managed properly, a person can die. While here in chikungunya, there is a significant morbidity. There is a pain, everything is there, but patient would rarely die. So that is the thing. And third virus, which is Zika, though it is not that much common in India, very common in South America, which produces mild infection in apparently in the healthy person and the adult person, but if it occurs to the pregnant lady, it produces severe damage to the fetus, and there would be microcephaly and all that complication would there. And Zika is already detected in Ahmedabad, so we have to be careful because it is the same mosquito Aedes which transmit this. So once it comes there, these Aedes can transmit dengue, can transmit chikungunya, can transmit Zika. So if we have got dengue and chikungunya, we can expect that Zika can also come. And the problem with dengue and all that is, if mosquito once it is infected, it would pass that virus to its future progeny. So all other mosquito, which is this mosquito's eggs, would contain virus, and that future mosquito also can transmit the infection without biting a new human host. So that's why control of vector is extremely important in arbovirus. KFD, Kasnur forest disease, it is seen in Karnataka, Kasnur forest, and also known as monkey disease because monkey is also one of the reservoir. Sorry, it is transmitted by tick, not common in other area of the India. And Chandipura, this is transmitted by the sand fly. It is a fly which is seen on the river bank, and it is a blood sucking fly. So that transmit the infection, and there would be number of unexplained outbreaks of encephalitic illness. In some area of the Gujarat like Sabarkantha and all that, a few cases are reported of this virus. So we have to be very careful for this also. Prevention, as I have already discussed, that avoid the exposure. If mosquito would not bite, because it bites in daytime, so especially in the season where mosquito breeding is higher, in the winter, in the monsoon, full sleeve clothing should be there, so we are protecting ourselves. Mosquito repellent can be applied, so that would if mosquito bite is prevented, the control and the eradication of the vectors. So it would the mosquito would breed in the clean water. So if water in the cooler or some stagnant water is deposited somewhere, the mosquito, it takes 1 week. So if you change water after few days, then mosquito would not breed. So we have to be very careful. So it is very easy to prevent this disease, but once it occurs, it is very difficult to manage, especially dengue. It costs us a lot. Many lives are lost in this. So we have to be extremely careful in the controlling the vector and the control of the reservoir host. So in the summary, dengue is very important topic. Its lab diagnosis or entire short note on dengue virus can be asked. Chikungunya is the other, may be asked in short note and the short questions or the objective questions. Japanese encephalitis is also common in India, may be asked in the short questions or the objectives. And CCHF, the healthcare worker must be aware about this virus and take proper universal precautions when they are dealing with such patient. So with this, these are the simple ways by which you can stop the transmission of arbovirus. So with this, we finish today's lecture. Thank you very much. Again, we will meet with new lecture. Thank you.